Hi, welcome to the Wounds of the Heart, where we are here to help you heal any wounds that have been caused by trauma, emotional issues, psychological issues, abuse, whatever it is. We are here to bring expert professionals to help you heal that wound. And this afternoon, once again, we are here to also come your way with something that is intriguing, something that you would also what are you saying? And they are real. We bring real issues here for us to discuss it with people who have the know-how to help us understand them. And this afternoon, if you are with me wherever you are, I would want you to join the program on our social media handles, Hope Channel Ghana, Facebook, YouTube. You can send your comment and also any question, referral, whatever it is. You can put them there and I will have time to refer you or to talk to people who would be of help to you. If you want to WhatsApp us, it's 0559-680066, 0559-680066. That's WhatsApp. Just drop anything you want to drop there and we'll have time to talk to you. If you want to help Wounds of the Heart rich campuses, especially the senior high schools, 0559-535554, 0559-535554, and I would respond to that call and we'll see the way forward. I'm always happy to sit here to bring people to help understand certain things that we see out there that we may not have any clue of. Today, I'm privileged to have that beautiful lady who came here some time ago to help us understand palliative care. That if you watch that episode, then it means you know who I'm referring to. For the first time viewers, she is a mother of 4. She is focusing her health issues on female mental health. So as a mother and also helping women their mental health, then you know that she's always passionate about what she do. She is a clinical and health psychologist and she has been doing this thing for the past 8 years and still counting. She's a member also for Ghana Palliative Care. I want to mention it so that you know that my guest is not just a psychologist when it comes to clinics, but then she's also a member of Ghana Palliative Care. She is the person of Masha Boy Bashiru. Masha, once again, welcome.
Thank you so much. It's such a pleasure to be back.
Yes.
And hello to all your audience.
I'm happy to have you today too.
Wonderful.
And the last, what we did, it was so beautiful and I thank God for that comment. Right. Masha, the Bible says, I'm a Christian, so let me use.
Absolutely.
And I'm sure if you're a Muslim, you know that bearing of children or childbirth is something that is blessing to every household. That is why when people are not giving birth, society gives them different names, and friends and loved ones tend to use that one to tease them. Bible says that children are heritage or inheritance. It's a gift from the Lord. So whenever somebody marries, the first year, everyone is expecting that they will put to birth.
Yeah.
But this glorious experience, there are people who would never want to. You are shocked, right? Yes. They are afraid of that. And that term is what we call tokophobia. This afternoon, I want Masha to help us understand what it is and how best we can help people who are experiencing what we call tokophobia. Masha, I just gave an overview.
Right.
But what is actually tokophobia? What does it mean?
So tokophobia, when we think about it in a clinical terms, we are looking at an excessive fear of childbirth. So having a bit of fear is appreciable and is understandable when it comes to childbirth, especially when the person is a first-time mother. However, tokophobia is an excessive fear, and there are certain behaviors as a psychologist we are looking at to show that someone may have an excessive fear. So you would usually notice that those people, so here we are talking about the contents of women.
Of women, exactly.
Yes, because in the outside world, you know, you have persons who are giving birth, but then women in Ghana.
Yes.
So women would usually, you see they'll be doing things that are in extreme, and you begin to wonder, why is this happening? So yes, this is when you notice that someone may be having a tokophobia. So tokophobia is known a lot in the outside world because they've named it and they are able to clarify it and classify it. So about 10 to 15% worldwide, tokophobia affects women. In the African context, in Ghana specifically, tokophobia is not much talked about.
Exactly.
You know, we have a lot of pressure on a woman to deliver. So how would a woman open up and say, you know, I'm scared to give birth? Because there's a lot that is attached to woman's identity. So in Ghana, we name people after the children. So it says, oh, this is Juliana's mother. You know, you don't, so you are named, yes, you are named after your children, like you're Juliana's mother or you're Kweku's mother. So there's a lot of pressure and a lot of values that are attached to being a motherhood. Motherhood is also, like, as you mentioned, it's an inheritance. What do you have to show forth? And for many years, you know, this has been a debate that what do women bring to the table, because a lot of times they feel it's just about giving birth and it ends there. But giving birth is not only biological, it's as equally as psychological. There's a lot of changes in the mind and the body that happen. So you can't separate the mind from the body. So if the body is going through all these changes to accommodate a baby, and sometimes twins, triplets, to accommodate all that. So you can imagine what has to happen mentally for a woman to be able to understand the fact that I'm going to be a mother. So tokophobia does not only mean that it's not there, but in Ghana we hardly talk about it. So if someone doesn't open up about this, you barely know that someone may be having struggles about giving birth, but there will be signs.
There will be signs,
okay. Yes, there will be signs.
We'll come there. We'll come to the signs. We'll come there. Masha, we'll come there. Right. Viewers, in case you just joined, we're discussing something that we don't really talk about, and that is what we call tokophobia, the excessive fear of giving birth. So if you have a sister, if you have an auntie who is not talking well about giving birth, and they have been married for a while now, and they will tell you there's nothing wrong with them, there may be an underlying condition or situation that is not helping them to come out with that. So we are here to delve into that situation and see the signs, as she mentioned. We'll get there for you to align those signs to that person who is not they have been married but yet there's no sign of children, and also probably not married, but then her conversations will let you know that when even she marries, children there, it will be something else. So please, I want you to tell somebody somewhere that wounds of the heart are started, and we are discussing what we call tokophobia. It's a less talked issue that troubles women, especially women. You made mention of the Western world. Yes. Here, Ghana, we may not know they are real. We may not know it is there. Yeah. But I want you to send it a comment section that you have that, so that I'll get to know how many people in reality in Ghana here, how many people are afraid, excessive fear of giving birth, so that we can also use that one as a case study of statistics to also add to whatever we have. Yeah. To outside there is common. Yes. Here it is not common. Right. But why is this condition overlooked or misunderstood?
Yeah. So I think I mentioned earlier, because of the cultural and societal pressures, a lot of identities attached to motherhood. There's a lot of pressure, a lot of expectations, because they believe that as a woman, that is your only job that you have to do. Also, it is very foreign in our culture, because we are family oriented, where a couple says we don't want to have children, you know, regardless of whatever condition is behind it. When the family tells you we are not ready, it raises a lot of flags, because you expect a continuation of lineage going on. You know, unless your family, your in-laws are already planning, you should be having 3 or 4 by now. We want 2 children, 2 girls, 2 boys. So that sort of pressure does not give room to be able to talk about it. Sometimes people might have secondary traumas. Okay.
Okay.
So this secondary traumas is basically based on what they have observed.
Okay.
So maybe they might have observed their mother struggling during childbirth, where a lot of instruments were used, a lot of side effects of it, and imagining yourself going through that, it's a no. So as I mentioned, it goes beyond just the biology. So biologically, we know what has to be done for a child to come. Then there's a psychological. You need to be psychologically and mentally okay to be able to go through that process of accepting that you are going to become a parent. So there's a lot of emotional pressure. So there's anxiety, there's stress, because when you don't give birth within a certain specific time, then automatically people begin to think that you have a problem. And you know, the recent statistics.
Tell me.
Yes.
Masha.
The recent statistics about fertility issues in Ghana. Most of the fertility, or we call it fertility, but you know, to the layman person is infertility. So infertility issues stem from men than women. So when you have married couples coming in, most likely the problem is coming from the man. But Masha, how many men in Ghana will accept that I have a problem?
I'm the man.
Yes, I'm the man. I'm just going about what I have to do. Exactly. So that ego is also there. So a lot of times women shield the family and take the blame for themselves. I have personally had couples where the problem was a man, and for him it was denial. It's not because he had children before meeting this person. But you know, there's also a decline. There are other conditions happening, lifestyle and all that. So being truthful to yourselves helps to be able to release some of that stress. But then if you have a partner who is in denial stage, who feels that his ego is going to be bruised, imagine what the wife had to go through. So that sort of pressure, she's not wanting to go through that. You know, also I think another thing that people don't want to talk about is the realities on the ground. Some people don't even know that what they went through was a traumatic birth experience, because that is all they have ever known, especially for first-time mothers. So they have all known that, labor has to be painful, labor has to be like this. So even when they are going through pain, they are not able to comprehend that what they went through is actually trauma. And there are different types of birth trauma that people go through. Sometimes people have had multiple pregnancy losses. Sometimes people had a pregnancy loss where they weren't even aware that they were pregnant. So when this has happened for several times, how will you think the person would wish to get pregnant again? So that sort of fear sometimes happens. But you know, a bit of fear is acceptable, but tokophobia comes with excessive fear. Yeah, so excessive fear. So anything, even though there's a desire somehow, that fear overshadows it. So what it becomes that anything that you need to do to be able to get pregnant, they avoid it at all costs. Yeah, so sometimes people might actually be pregnant, but then because of that fear, they tend not to they don't tend to progress with the pregnancy. Sometimes people tend to choose certain medical procedures that are contraindicated for them, but because they feel this is the only way I can be able to bring out the children, I'll go for it. So tokophobia goes beyond just not wanting to give birth. Sometimes it does happen to people who are actually pregnant and they didn't know they had that fear. So how do you talk about something you never knew is going to happen? But that fear started when you got pregnant. Sometimes people are actually pregnant, going on very well with their pregnancies, and then every time they come for maybe their consultation and during the antenatal clinics, they hear one happen, another thing happen, another thing happen. So yes, they begin to internalize those fears and they make it personal. This could be me. I don't want it. I'm scared. So anxiety starts really slow and it builds up over time when you don't manage it, you don't identify it. So sometimes we don't talk about it because nobody is really aware that, am I really scared about it? Yes, because childbirth looks very beautiful on the TV, in the movies where you have you have your supporting partner around, you have a whole room full of flowers and candies and balloons. It's beautiful, but reality is that what it is. There are lots of female complications that happen during pregnancies afterwards, even with the children. So some people had pregnancies where children were born to term, had neurological conditions, lifelong devastating conditions, and then they have to deal with it. That can cause fear in the subsequent pregnancies. Okay, sometimes people had losses, as I mentioned earlier, and that's going to be a no-no for them when it comes to pregnancies. Sometimes people were, so this goes a bit deeper, so it goes to even instances of people where they were sexually abused. Some people were gang raped.
Mm-hmm.
So when it comes to anything intimacy, it becomes an extreme fear for them. And trauma is stored in the memory, and it manifests usually in the physical side. So you realize that intimacy is a no-no for these people, not to talk about childbirth. Some actually got pregnant as a result of those acts, and they had to terminate it for some reason. So some people are living with guilt. They had to live with guilt for the rest of their life. So they don't see themselves bringing a life into this world again, because this is the path they took in the previous life. So it's really a big problem, especially in the African context, because we don't seem to have a very accommodating society that talks about losses in pregnancies, because any loss that happens, and I've personally seen cases where when there's a pregnancy loss, it's a woman who is being blamed. So you see a partner, not always the partners, okay, but sometimes partners have to take the blame. So partners will say, I told her to do this, she was eating this type of food, she was sleeping on her stomach, she was, riding Okada to work. So all these things, yes, they are risk factors, but it is not a justification why things happen the way they did. So you realize there's a lot of blame already proportion to the woman herself that going through that. Yes, so it doesn't give us an opportunity as women to be able to talk about our fears and losses, because imagine being married to a family where there's only one son, so everybody's looking up to him, he's the head of the family, of the business. How do you open up and say, there's something I don't want to go through? So this, I think, goes inside your field to be able to have that in the marriage counseling with couples, to be able to talk about what is your plan when it comes to childbirth. So marriage counseling should continue even after marriage. And then, post marriage. I don't know how you would call it, post marriage. Yes, post marriage, and then also preparing them to become parents.
It's a whole thing on its own.
Yes, it has to be throughout, so that people start preparing their mind before they even get there, because you assume the role as husband and wife, but your roles will change at the point in time where you become a father and a mother. And sometimes even men are not prepared to become fathers. So this is where that gap, the very big gap that comes in. So people don't open up to talk about it. Yes, we are also being shamed. So I've had someone who had about 9 pregnancy losses, and then she has to go back to the same compound house. So there was a comment that says, why have you been eating your babies or what?
The stigma is too much.
Yes, the stigma is too much. So how would this person now say, I'm scared to go? Because everyone expects you to go and come home with holding a baby. So issues like this is very hard to discuss. So you see that I interchange between fear and birth trauma, because in our context, from my experience and also from my practice, we deal more of not just the fear, but then also the trauma. So a lot of the things I'm talking about has to do with birth trauma. So I apologize if it's confusing.
Oh, no, it's not confusing.
Yes,
it's a cause. It's a risk factor. We're on track. And
absolutely.
You see, so you mentioned, but then can we also add the fact that stillbirth?
Yeah, stillbirth. Absolutely, Daniel. This is one of the most painful experiences for any couple to go through. Stillbirth redefines your whole understanding about your well-being in that particular moment, because you had very high expectations of how you want your family to be. There's always a perfect picture how you want your family to go. Having baby photo shoots, baby gender reveals, finally announcing to the family that they're finally going to have a grandchild, a grand niece and nephews. And this is the case where you have to actually give birth to a baby that is not alive. Sometimes the mothers are already aware, because they would have checked the heartbeats and all. So this also comes as part of the bereavement care that we do with our clients. So you have to prepare a mother knowing very well the baby she's going to bring forth into this world is not going to breathe, is not alive, and she has to go through all that pains that comes with childbirth. Yes, sometimes they are left with scars because they have to go through surgery, and then the baby is not going to be taken home.
Can that be under palliative care?
Very tricky question. You have to look at you have to look at the needs there. But then we also have bereavement care in the obstetrics. Yes, so most of them will fall more under the bereavement care in obstetrics. Okay, we also have palliative care in obstetrics. So if by assessment it falls there, why not? Okay, so as I mentioned, we don't only deal with yes. So that is one of the areas.
Viewers, in case you joined, we are discussing tokophobia, the excessive fear of giving birth or childbirth or pregnancy. A lot of women out there, the one watching, you know the reasons why you don't want to give birth. Your husband is not in the know. Your family members are not in the know. You are the only person that is experiencing whatever you are going through. It is not too late to reach out to us to help out so that we can be able to help salvage that situation so that you can also understand whatever you're going through to also put to birth and give your parent their grandchildren or their grandchild they're looking for. And let your husband be proud father. You know, Father's Days, one funny thing is that potential, they send potential father. Masa, that thing is not joke. Potential Father's Day, potential Mother's Day. This goes for people who are not, who haven't given birth because they're not fathering anything. But we want this Mother's Day, we want to wish you a happy Mother's Day because you have put to birth, you have brought out somebody that was made in you. Masha, we were talking about trauma. Those are serious causes of childbirth, and you made mention of childhood experiences. Somebody seeing the parent, the mother going through that ordeal, and also would give a decision not to give it. We may not know.
Yes.
Another point would be the fact that this woman growing up heard that as for her home, whoever gets pregnant wouldn't get the child, they go. How that perception, how can we how can we take that perception out from the lady's mind? Though counseling would do, but in your field as psychologists, what do we need to do?
I think so. The question would be, how do we help people to be able to understand?
Yes, especially specifically to the child experience is growing up to see that. How do we delete or clear that notion?
Yes, so our childhood experiences shape the kind of personalities we have. So there are certain beliefs, there's nothing we can do about them.
Sure.
Yeah, so they are imprinted in the mind, in the body, and personalities. However, what you want to do is to do some psychoeducation for our clients to help them know what exactly is the issues. You know, some people will tell you that their whole family, nobody has gone through surgery. Every woman delivered by herself at home. So you coming to the hospital, even to deliver, you're being seen as an outsider or an outcast. So they will not going to support you when you come there. So you need to understand the family dynamics. What kind of family are they coming from? What is their belief? Do they even believe in orthodox medications that they are receiving? Because someone said that once we give birth, we have some herbs, we mash, we drink, and everything goes on. Yes, also you want to understand their relationship. How do they bond with their children? Because when it comes to fear of giving birth, it also affects the way you are going to bond with the child eventually if the child comes out. So your perception about a child, how do you bond? So the bond starts right from the time you find out you are pregnant. The bond starts right there. But then if you have excessive fear and anxiety about this whole process, it's going to affect how you're going to perceive that. Sometimes there are people whose body visibly change throughout the pregnancy as a result of the baby that is coming forth. So when the baby comes up, there's that sort of hate towards the baby because of this baby, this is how I am looking. So that's also another aspect of it, putting aside the tokophobia. So changing perception is hard, but then you have to educate as much as possible. So when they come to us at the clinic with the psychology units, specifically for childbirth, we're looking at their experiences. What have they been exposed to? What has been happening in their life? What do they understand by what they are going through? Are there any specific things they like to do in their family? So you do a lot of exploration, history taking, you do a lot of listening as well. And then you also trying to find intervention. So if you believe this stems from trauma, you have to apply the trauma-focused interventions. If you believe this is purely about thinking, there are cognitive therapies that you can employ. sometimes people are just a little bit stressed out about the whole procedure, or stressed out about understanding what pregnancy does to the body. So then you can do some relaxation, take their mind there, employ meditation, prayer. They can also engage themselves in yoga, exercise. So anything that you have to identify the need, and then you work on those things.
Okay. So you see, I asked a question for you. Probably growing up, you've experienced all those things, and you think that no. As for you, the childbirth, you're not going to get yourself there. But it is not too late.
Yeah.
It is never too late. Everyone is expecting something from you. Everyone wants you to also see yourself in a child that you bring forth. Because, for instance, if I don't know Marsha's children, imagine Marsha's color, and Marsha will grow up to say that, okay, I'm not going to give birth, I don't want to give birth. And you see, if Marsha should put to birth all the children looking at like her or the husband, the color combination and stuff like that, how pleasing will it be with the whole family? I'm not saying that we are not forcing you to admit, but we are aiding you so that if you have experienced that thing growing up, it has formed part of your core, it has formed part of yourself. We need to help you understand the process so that you can overcome them. I asked that question especially for you.
Yes.
I know that we are going to go down there to see how best we can help people, but then this particular question was for you who have seen something growing up and you feel that no, because of this, I'm not going to give birth.
Let me also add something to it, that we also have something we call preconception counseling.
Okay.
Yeah, so this is
okay.
Yeah, so you can also walk into a facility and then you actually start planning. So pregnancy has to start from the mind.
Exactly.
Yeah, so you start preparing yourself. Is this something I can do? What are my worries? So you can actually walk into a facility pre-pregnancy. You don't have to be pregnant before walking into a facility. Yes, you can walk into Kolibu Teaching Hospital. You come in there and then ask. So I can only talk about what happens in my facility. So you can talk about preconception care. They can walk you through what to expect, what not to expect. They look at even your sickness status. A lot of people don't even know their sickness status. So all these things can be discussed, and then you can now, based on the information you have, knowing that will this work for me or this will not work out for you. And also we need to remember that we don't have to force to be something we are not. So if you have all valid reasons not to want to have a child, yes, you are free to do that. And the more we talk about it, so it starts from us, like this kind of conversation that you and I are having. We have it in a bigger platform where people can actually say that my dignity or my worth is not based on a child I bring forth. It's a gift, and it's not always everyone will be given a gift.
Exactly.
Yes, so you can be given other gifts.
Other gifts,
yes,
not
you can,
specifically
not specifically that.
Exactly.
So you can be given a gift of leadership. You can be given the gift of healing. You can be given the gift of other things. So children should not be a basis. That's why the outside world, they are very free to talk about it.
Exactly.
Because there's no value attached to the child. You can be a 50-year-old woman, successful woman, working in a corporate world. Nobody really cares about your private life. But here we are so much, wanting to know how to help each other. But then, yes, the more we have discussions like this and trying to normalize conversation that allowing women to be in charge of their bodies, allow them to make choices, will be the best. Because the downside about forcing people to be to be able to fit in the society is that sometimes that becomes a contraindication to even the woman's life. There's sometimes some pregnancies take away the quality of life of women. You can get stroke, you can get kidney problems, you can get heart problems. There are other conditions that are contraindicated for you, that once you get pregnant, this is what is going to happen. Yes, so we also need to be very sensitive. So this comes to people who come and ask, so when is the child coming? So yes, it comes from a good heart. But the good heart sometimes does not necessarily mean it's a good thing for the person who is receiving this.
What kind of good heart? What kind of
the good heart is that you are eager and you want to celebrate them.
You see,
yes.
You see, let me say this. Let me say this. When it is that traditional marriage, and the Ochiami will ask two people from both sides to talk.
Right.
And they will say all sort of things, and they would project even a year on, we want to come and have naming ceremony. Families, parent, please and please again, don't put pressure on that child who you have given the hand to marriage. No. The fact that every woman would want to have child after marriage doesn't mean your daughter is the same. Let us understand your daughter's mental strength for giving birth before. And Marsha says something. When is the child coming? It is none of our business. And you see, they are gifts. Childbirth, not all of us will get the same gift. Yeah. So don't force yourself or push a gift to somebody who is not ready to accept the gift.
Exactly that.
Because if you are giving me something I don't like, you don't force it. Yeah. It's a gift. So that at the end of the day, that woman or that lady who just got married can go through a sort of therapy to delect any perception and give in to give birth to anyone, any child or twins or whatever they want to give birth. So please, viewers, if you have somebody who is pursuing you, who is forcing you to, no, please, resort to us. We will help out. And parent, please. So lady, share this with your parent. That as for you, if you get married, they shouldn't force you. And society, stop pushing couples, newly wedded couples, in giving birth. Stop.
We support that.
Stop. Society, please. Maja says she supports. Stop. Because at the end of the day, allow these couples to think through and come out when the gift is ready for them to receive. In case you just joined us, we're discussing what we call tokophobia. It's less spoken topic in this part of our world. And that is an excessive fear of giving birth. And mostly by women. The men we are free, mostly by women. Yeah. I don't want you to go anywhere. We are going to talk about the signs and the symptoms of people experiencing tokophobia. I'm not sure you want to miss this. Stay tuned. We'll be right back. Yes, we'll come back from the break. Thank you so much for staying with us. And as I said, we are discussing what we call tokophobia, the excessive fear of giving birth or childbirth. A lot of women are asking don't know what is happening to them, parents and society. If you have any question, if you have any comment, please on our social media handles. So Facebook, Hope TVGH. Same as YouTube, and on our WhatsApp platform is 0559 680066, 0559 680066. And if you want my personal contact to 0559 535554 and send me anything. If you need help, I'll refer you to people like Marsha who are in the business already, so that at least we can help you out. Marsha, now we don't know this lady isn't ready for childbirth. We don't know this person is going through tokophobia. How do we detect? What are the signs and symptoms of we knowing that this person is experiencing tokophobia?
You would usually hear someone say, as for childbirth, it's a no for me. So some people are going directly to let you know that. They say it? Yes, they say it directly that this is a no-no. Sometimes you see a lot of avoidable situations. So anything that has to take them to labs, anything that has to do with maybe going to the baby shops, looking at baby clothes, choosing. So you realize that anytime there's a conversation that comes about childbirth or children, they usually try to avoid it. So it's an avoidance behavior as you're looking at it. Some of them actually wouldn't show any signs or symptoms, but they get to know only when they are pregnant and maybe about to deliver. So sometimes they can go first trimester, second trimester, fully functioning, very excited about pregnancy, but then when the time is getting closer to labor, they begin to panic. So they might have had people so much pain, they might have had maybe they came for an appointment, they heard someone screaming, they might have heard some bad news about someone, they may have received some diagnosis at some point in time where they were not too happy about it or very scared about it, or maybe did not understand what the diagnosis was about. So some people begin to experience those symptoms. So there's a lot of fear, there's a lot of anxiety. So anxiety is an anticipation. Sometimes it may not have happened, but you're anticipating for it to happen. So that is, so you are beginning, so you have a lot of racing thoughts, and racing thoughts obviously begin to race your heartbeat, your heart rate, pumping blood, and so a lot of physiological things are happening in your body, as long as in as much as happening in the mind as well. So you notice a lot of avoidance behaviors, as I mentioned. People are direct telling us, as for childbirth, it's a no-no for me. Sometimes they'll tell you that I have heard or I have seen. So that is a secondary type of trauma. So, I was just visiting a friend in the labor ward, and then I saw this. So for me, it's a no. So this is also secondary sort of form of tokophobia. And of course, the biggest one is when the child comes in. So somehow the person managed to go through all the stages, managed to deliver the child. How they bond with the child. So they begin to be, there's a disconnection in the bond between them and the children. So that also becomes another postpartum problem. Some people also begin to opt for certain medical procedures. So instead of having the vaginal delivery, they would want to have a surgical delivery. They would want to have a lot of pain medications. They would want to do a lot of things that usually you will not be seen as part of protocols when the child is coming in. So this will be the signs that someone might be scared about it, but may not be voicing it out. Sometimes they may ask a lot of questions. What happens at every stage or at every minute? So some sort of anxiety, it's okay when women have it, but then you notice that it's an excessive. You see it in their breathing. You will notice the way they keep moving about. Sometimes they don't go directly to the question, but they keep, moving around in circles, asking questions, and then that can signify that there's something going on. So these are things that usually would indicate someone might be having. And then, of course, we have extreme cases. So those ones are very clinically clear cases, and then, as I mentioned, so there'll be a lot of fears. Some people might panic when it comes to thinking about anything that has to do with childbirth.
But can it be that somebody who has given birth 1, 2, but yet the third child?
Yes, absolutely. So every pregnancy is different. Every pregnancy has a different experience. Some people might actually even have more than the 3.
How would people believe that you are afraid of childbirth?
That is why we need to have this conversation. So someone like this, how do you open up and say, I'm scared? Yes. Someone may have 1, 2, 3, 4, 5, very easily, smooth delivery. 5th one, anxiety happens. So anxiety can happen before the pregnancy, during pregnancy, and even after delivery.
Postpartum.
Yes, postpartum. So it doesn't have an end. It doesn't have a beginning. It can happen at any time. It can happen to any woman, even if there were no any risk factors. So usually a risk factor will be having a previous history of some sort of mental health. It could be depression. You can have symptoms of anxiety, or you might have had some childhood traumas, as I mentioned, like sexual abuse. It could be physical abuse. It could be an exposure to seeing someone going through some sort of pain. Or even personally, you might have experienced something around the gynecological aspect of being a woman. And then when it's your time to go, you begin to internalize it and make it personal. So yes, it can happen at any point in time. It's a subjective feeling.
Yeah. I'm looking at it from this angle where you have a close relative or a friend or somebody you know, and that person and the husband or the wife have given birth to one person, a child, and the lady is saying, I'm not going to give birth again.
Yeah. So she knows her story. So you have to ask, what was your story? And then you notice she can actually describe even the smell at that point. So you can tell, she can actually tell you the dress somebody was wearing, and she can tell you the sounds she was hearing at that moment. She can actually see her child maybe trying to be resuscitated at that moment. You're seeing the child maybe had to change color, or they had to rush the baby to NICU, and so NICU is intensive, neonatal intensive care unit. You would see that maybe there were certain procedures that needed to be done for a child, These are not the things you prepare yourself for. So when you are being rushed into it, sometimes people have preterm deliveries. They never knew that they could actually have preterm labor. They had no idea that maybe even seeing a premature child could leave some traumatic imprints in them. So all these things, how, if you don't ask, it is logical for someone to say, oh, maybe she's just pretending, you know, maybe she doesn't, whatever reason they want to, you know, there's always an excuse for someone's behavior. But when this person begins to tell you her story, you begin to know there's much more than just biological process of giving birth. A lot of things happen. And when you are hearing that story, you know that this person really struggled throughout. And the saddest part about it, because of how quick things happen in the medical setting, sometimes you may overlook the mental health for someone because you're looking at the emergency. How can we? So in obstetrics, you always have to save the mother first.
Okay.
The pediatrics will obviously also have to save the child. So in between this thing, what happens? That sort of silence. What do we do? What happens? What just happened? You know, I came in healthy, very well, and all of a sudden I'm being rushed to the emergency, to the theater. So a lot of things happen at that time. So that waiting period alone could be something else. Sometimes the woman is on the theater table having a surgery. She's doing very well, but then the child, you hear everybody rushing in, making calls, all that, and she has to just lie there and wonder what is going to happen. So that alone can leave a sort of trauma. And obviously, if you go through this trauma and you haven't resolved it, how do you want to go through this same thing again? So that's the challenge.
Happy Mother's Day to every mother who had gone through these things we are talking now. It's not easy for mothers to experience childbirth, whether vaginal birth or
cesarean
CS. It is not easy. So when somebody says that I won't give birth again, we shouldn't be quick to judge. There may be a source, there'll be a reason why the person is saying, I don't want to do it again. So let us rather get closer to know why than to stand afar and conclude. Please, it's the person who knows what he is going through. Masha has said a lot. You and I know, you have a lot of people who have told themselves they are not going to give birth again. Though the plan, growing up, the plan was to give birth to 3, 4, 5, but now 6. it's over because of the ordeal they went through during that period.
Yeah.
But hey, you may also go through that ordeal, but we are here to help you overcome that ordeal so that your husband will be happy to have that second or the third child. And husband, please, let us support our women. Let us support, man. It's important too. Women suffer. They suffer. What will support them?
So let me throw this both to you. So sometimes the woman has gone through all this, but then the man saw it, and he says that I don't want to put my wife through this again. What do we do?
So no, you see, if I know somebody, if somebody is watching this, that person will laugh. But there's experience.
Yes.
So I asked this lady, then why the third child? So you see, that's the reason why between the second born and the third child, there's more years, and we didn't want to, but we don't even know what happened.
Yes.
You men always say you don't know what happened. Yes, you know what really happened too.
Yes.
But beautifully, I quite remember one of the sisters I know. We turned into prayer. Psychologically, we were there, but then we also added the spiritual aspect. And by the time she even delivered, the husband wasn't in the known.
Yeah.
And it was so beautiful. So when, for instance, I saw a husband like me seeing my wife going through CS, I wouldn't want her to go through that again because of what I saw.
Yes.
I may stand, somebody may not be able to stand.
Yeah.
The wife or the woman would want to also give birth again.
Yeah.
But the husband may say that, know what you went through.
Yes.
In this case, let me throw back to you. You are there. In this case, what should we do with the men?
Yeah, so they will need somebody to talk to.
Thank you.
Definitely. There's some sort of trauma going on.
Thank
you realize that from the cases that I handle, a lot of time women seem to have more resilience than men. So you see men walking, you know, when the wives are in the labor ward, you see men pacing out, praying and all that. And then when they see their wives, you know, they put on the hard guy coat and walk around. But then, yes, they are also broken. And because mental health men's mental health is not something we talk about. They don't know what to do. So they have to deal with the fears, the stress, the anxiety, going to the hospital, moving up and down, because they are usually the financial aspect of this whole labor thing, going to do medicals, labs,
cuts,
going look for blood and all that. So there's a lot of stress financially, physically, going up and down. And then their own fears. I put my wife through this. Maybe I should not have put her through this, and I don't want this for her anymore. Yes, he would like to be a father of 5 or 6 or 7, but then looking at what he has put her wife through. So yes, men like this, you need to talk. Don't carry that burden upon yourself, because you also realize that when you talk to men about these things, they can actually tell you that my mom, my sister, my auntie. So there's somebody in the family who went through this, and then he will start to blame himself. I knew this. Why didn't I prevent this? So through that, you're able to uncover some of the, even some of his own childhood traumas and stresses he was dealing with and battling. Yes. And then through therapy, you're able to uncover this and help the person to cope because, you know, now if this happened, that it's a successful labor and the child and the mother are all fine and the father is not, it's going to affect the dynamics of how they're going to care for the child. Okay, so that bond, sometimes the men can't even bond to their wives again. Yes, they see their wife and they feel like this person is a stranger. So definitely you have to be able to work on this. And when you are able to help one person of the family, you're helping the other as well. And the kind of environment the child comes into is very important. That's why you need to be able to address people's fears, anxieties in a healthy way, through therapy, through counseling, through medical debriefing, help them understand things from the medical perspective, their emotional state. And then spiritual, as you've also added, praying for people, helping them understand that it's a multitude of factors that come in together. You can't isolate one and work with it, because it has to be multidimensional to help.
Talking about the bonding, the mother-baby relationship.
Yeah.
To what extent can it become serious between the mother and the newborn baby who doesn't know anything? Because of the excessive fear that the mother went through before the child was born.
Yeah.
How serious is that?
Yeah. It can have always adverse effects on the child. You know, the very first 5 years is very crucial to child development, personality development, most of their habits, so children regulate through parents at that age. So if the mother has anxiety, the child picks it. It's an instinct that they pick up. So that child is also going to go with a lot of anxiety. So the very first, so some mental health conditions starts from early childhood. So anxiety is one of the earliest mental or mood problems you see in children, like for example separation anxiety, when you have to take the child away from the mother and somebody else has to hold the child. You notice a lot of behavioral signs, extreme crying, extreme moving, trying to reach out to the mother. And these are things that the child learns. So nurturing, you've nurtured the child through that. So yes, that can affect how the child develops. The child can also start having some traumas from through the way the mother interacts. If the mother is not in a very well-being state, and that anxiety now becomes a postpartum anxiety, there's some sort of restriction of how much care you are going to give. So you are constantly checking if your child is breathing, if your child is alive. You wouldn't want to give your child to anyone else because you believe they're going to harm the child. You're going to be exhausted emotionally. And when the one caring for the child becomes emotionally exhausted, they tend to make some mistakes. So this is the danger where she may fall asleep at a time when the child needs her most, may overlook there were things maybe have been on fire, and the mother has been exhausted because anxiety drains you physically. The house may be catching fire, or there's some things where you become less aware of your environment. There might be smoke coming out from somewhere, and she may fall asleep. She may be very forgetful. So these are some of the dangers that it can actually harm the child. And so the bond there definitely is going to be affected, because you can't give what you don't have. So this is someone who is struggling mentally inside. How much love can she give? How much care can she give? So it's going to be affected. Lack of sleep also causes it. So lack of sleep during that period and a lot of hormonal fluctuations, if it's not managed well, it can lead into something else. Sometimes people hallucinate. Some people hallucinate. So that becomes other aspects of postpartum conditions. So all this thing definitely has a long-term effect also on the child. marriage-wise, it's going to affect how you two relate as partners, because now your roles have changed. You are now mother and father. Your roles are going to change. So if both of the parents are dealing with anxiety and then caring for the child, you can imagine the chaos that is going to be there. So yes, how the kind of fears and feelings the mother experiences directly affects the child. And the way the mother experiences those things also directly affects the spouse. So when we come to statistics of mood and anxiety disorders, postpartum depression in men, that is the fathers, are directly correlated to how women feel. So if you have a wife who is experiencing some sort of postpartum anxiety or depression, you are highly likely to also get it. So there's a percentage of men, I think 1 in 10 men, by worldwide statistics, but in Africa it's about 8% of men who experience postpartum depression. Yes, it does happen. So it is, you are all connected because you are now a family. So whatever happens to one member of the family has a larger effect on the rest of the family. And definitely that's going to affect how you relate to your in-laws, your grandparents, because you're always anxious. You're always not knowing how things will become, what to expect from anyone. You want to isolate yourself. You want to keep things to yourself. Yes. So
how do we help them?
Listening, giving yourself opportunity to be there. Sometimes you don't have to say anything. It's like, I can see you, I hear you. I know things are not easy for you. There's somebody who we can talk to. Do you want me to help you out? Do you want me to take you for your appointment? Is there anything I can do at home to help you relax? Can I take care of maybe the cooking, the cleaning, so that you
This is from the men?
Yes,
family members, whoever closer to the woman.
Anybody at all, yes. Sometimes even friends can say, you know what?
Exactly,
We are coming to take care of your child. I'm going to hold your child. You just relax and enjoy Princeton's treatment. And then we are going to cook, we are going to clean, we are going to do your makeup. And all these things are all very helpful because motherhood is lonely.
Exactly.
So if you don't have enough support, these are women who are most likely to have some of sort of mood and anxiety problem during their postpartum period. And postpartum goes all the way up to 2 years, not just giving birth exactly. So some will start somewhere from pregnancy, or can appear somewhere maybe 6 weeks after birth, 8 weeks after birth. And a lot of those anxieties even happen when you resume work. So after your maternity leave, you come back. So yes, at any point in time, giving some sort of help, relieving the person of some of the duties, taking turns. So this is for partners. If you realize that maybe your wife is more exhausted in the night, you can step in, take care of the child. You can also do sometimes some takeaways. It's not always that you have to cook.
Yes, sure.
So sometimes you can do some takeaway.
Relieve your wife from those stresses.
Yes, relieve your wife of those stresses. If you think that maybe your job is more demanding during the day, then you're pushing yourself some roles that I may be not very active in the morning, but I'll be more active in the night, and vice versa, so that both of you will not become depleted and tired. Yeah, for families, it's trying to give them as much privacy as possible, but then also letting them know that you are there for them. You are there for them, whatever it takes for appointments, you are there. If there's a need to sit with the baby, you are there. And also, a lot of judgment comes from the type of feeding the baby is going through. So some mothers don't have enough breast milk to feed their babies, and then you begin to judge them. But the breast milk is the best, you know, you have to eat this and you have to eat. Some people are just not people who produce enough milk. So having other options to feed the child is still a healthy option. So judgment is a no-no in any case. You need to be kind to them because you don't know their story. Your whole lineage may have gone it very easily, but then maybe this particular person is not having it easy. So we shouldn't label people that they are lazy or they are just not trying to be a mother enough. There are lots going on in the background. 3, you try to help, but from a distance. Just ask them, find out what can be helpful, what can be helpful for you. And 4, you have your medical team as well. Whenever you go for your postnatal reviews or antenatal reviews, you can find out some of the questions that are bothering you. Is this normal to experience things like this? You can also speak to your midwives, those who have to meet them. I've been experiencing some sleepiness for some time. I'm not able to hold my baby. So in Ghana, if they see that you and the baby are in danger, just come and talk to somebody. Nobody's going to lock you up and take your child away. So there's always that sort of clause where we want to help out.
Absolutely.
So don't be scared that if you reach out, somebody will take your child away from you and label you as that. No, we are very accommodated and patient-centered. So yes, we take all that into consideration. So just walk in, talk about some of the challenges so that they can refer you appropriately, whether you're to see a medical person, you're to see you know, a midwife, maybe you need to see a lactation specialist, maybe you need to see a dietitian, whatever you need to do, a psychologist, a psychiatrist. Yes, all that help is available in the bigger hospitals. So you don't have to struggle alone. And for those who are not very sure, as I mentioned, you have preconception counseling at the units, whether it's at the gynecology department or directly at the obstetrics department. You can walk in, ask all the questions that all the questions you may ask, and even at any point in time, attending antenatal school, so pregnancy school, you can also be able to discover some of the myths and misconceptions about what even labor and pregnancy is, and then perhaps you might become a little bit more acceptable to thinking of having a child. But then if it's still not for you, we need to appreciate those people, and then the more people we have in a society to normalize that women's worth or qualities are not tied to pregnancies, the easier we make it for the girl child to thrive, because a lot of people believe that their only job is to give birth and it ends there. But there are lots of possibilities that women can do, and in the outside world, you know that nobody's really going to ask you, do you have a child or not? In the Europe now, there are certain countries that actually request people to enter those cities because there's a decline in the population. There are a lot of incentives to people to actually give birth, because they realize now the age has gone up. First, maybe people used to give birth in their 20s, their 30s. Now, even as late as 40s in some of the European countries. No, it's a no-no for them. So they want to attain their career, profession, you know, grow up in a certain field or achieve certain things before they can think about childbirth, because now childbirth is so expensive.
Viewers, my time is up. My time is up. And as Marsha had educated us, it is important that you and I understand what our women goes through, especially those who may not want to give birth, and we may not know why they are doing that. It's all about the excessive fear of giving birth. It doesn't matter whether the person has given birth before or not. What matters is that every pregnancy has its own way or experiences that the person will feel. Husbands, families, let us get together. Let us help our wives. Let us help our mothers. Let us help our women, so that they would also know that we are there for them. And as she said, and I end with that, judgment is no-go area. No stigma. Don't judge them, but rather get to understand their predicament, so that you and I will help them overcome them. Marsha, God bless you for your time with me. Marsha is for female mental health. So if you need her, please, you see me. You can't bypass me and meet her. See me, and I would introduce her to you. She takes programs for churches, for institutions, corporate institutions. And if you need her services, please, she's there for us. She's there for us, and she will come and deliver, especially with women fellowship, women ministry, women organization. Please don't let this knowledge go wayward. No, we wouldn't allow her to sit in that small room alone to minister one-on-one. But you and I would need her services. Thank you so much, viewers. I know that you're going to send a lot of comment. If you have experienced any of this and you still experience it, please put your name there. Especially if you said something. Viewers, my time is up. Permit me. You said something about the fact that the bonding.
Yes.
If you have been told as your mother, I didn't want you to leave. I hated you. Those kind of stuff, and you think that a lot of things you are doing is not going well. Please leave your name and your on the comment section, or on 0559 680066, 0559 680066, and we will get right with you to help you out. Thank you so much for staying. Marsha, God bless you, and bless your family for allowing you to come and sit here to go through with us. And viewers, God bless you guys so much for being part of this program. And I have been your regular host for the Wounds of the Heart. My name is Pastor Daniel Abiribidewa. I'm out.